This is Dr. Russell Schafer from NOLA Dentures and General Dentistry. Today I'd like to talk about using a denture. Many people are kind of unsure what actually dentures should do for them, and I'd really like to break this down into 3 different parts. The first part is wearing the denture, the second part is speaking with the denture, and the third part is chewing with the denture. Now, when I give a person their dentures for the first time, the first thing to work on is making sure they can wear it comfortably. I usually find that wearing is the easiest part of a denture because you want to wear them. They look pretty. They look much better than the teeth did beforehand. And especially for my patients that love their smile, they always want to show it off. I have so many patients that for many years they hated smiling, they hated showing off their teeth, they were always embarrassed about it. But then when they had a new smile in their mouth, they were always wearing it, they were always proud of it. And they love the way it looks. So generally it takes about a week or so to get used to wearing a denture, especially if you love the way it looks, because you want to wear it. The second part to it is speaking with a denture. Now what I find is that when you first put a denture in the mouth, it always feels big, it always feels weird, and that's because the tongue isn't used to it yet. In fact, with top dentures especially, often there's a little bit of a lisp because the denture touches the tongue a little bit sooner on the roof of the mouth than the tongue is least used to. Now, when my patients first start wearing a denture, the way I recommend getting the tongue used to it and learning to speak well actually is just singing. What I tell all my patients is go buy their favorite CD and throw it in their car and just sing to it for weeks on end. The final part of it with the denture is chewing with it. Now, chewing's probably the most difficult thing to learn how to do with a denture. What we recommend is they first start with the softest foods, like yogurt, smoothies, mashed potatoes, and eggs. What this does, this lets them start practicing on how to swallow, how to use the muscles, how to use the tongue, to get used to having food in the mouth, as well as having a dental prosthetic in there as well. After a few weeks of learning how to practice with these softer foods, they move their way up to harder foods such as baked fish, baked vegetables, red beans and rice, jambalaya, and these sort of foods help people learn how to manage chewing on both sides of their teeth. Because when you chew with the denture, you can't just chew on one side, otherwise it pops up. You've got to chew on both sides evenly so the pressure is uniform across the gums, across the mouth. And after about a few months of practicing with that, generally people work their way up to baked chicken. And I find baked chicken's a very reasonable place to be at after about 3 or 4 or 5 or 6 months of wearing a denture. Now over the years, people will learn how to chew better with it, but again, it just takes practice. Now, if you're worried about wearing a denture for the first time, or you feel that your denture right now just isn't doing what it needs to do, give us a phone call at 504-392-5104 and we'll help you out. Thanks.